in Department of Anesthesiology at JSS Medical College. His areas of interest are pediatric anesthesia, ultrasound guided nerve blocks. He is a AHA accredited BLS and ACLS instructor, resource person in various state and national level workshops in CME, 6 publications in peer-reviewed and in index journals, papers and posters present in various conferences. Welcome you, sir. I would like to call upon our first speaker for the session, Dr. Suvarna K. She will be delivering a talk on operating room logistics. Thank you.
Welcome, madam. Dr. Suvarna K. She is working as a professor of anesthesiology in the Government Medical College, Kozhikode, Kerala. Her interest is segmental thoracic spinal anesthesia, difficult airway, pediatric anesthesia, interventional pain management. So, over to you, madam.
Good afternoon all. I see very few audience. Thank you, Chairperson, for the kind introduction. The topic given to me by Dr. Dinesh was operating room logistics. I have nothing to disclose. When I got this topic, I was wondering what this means. Why is it important? Why such a topic? Why is it relevant to anesthetist? So first of all, I looked at the dictionary. It gave a meaning that logistic means it's a careful organization of a complicated activity so that it happens in a successful and effective way. So OR logistics means how the organization and scheduling of the OR functioning is managed in the most effective way. That means logistics applies to every aspect of the OR management. Not just the designing or the planning of the OT complex. It comes to the material management, staff management, patient management, sterilization. Every aspect logistics applies. This is more relevant to those who are in the administrative post. They will have interest in this. So why is it important to us? Do you know? The healthcare cost comes to around the 10% of gross domestic product, and it is increasing the burden of national and the individual budget. And the operating room are the most expensive and essential resource of any major hospital. It accounts more than 40% of the hospital revenue and expense. And there is ever increasing surgical demand due to the aging population. So that is the importance of logistics. So improving the OR productivity and efficiency is crucial to ensure cost reduction, patient safety and hospital management. Sometimes there can be scarcity of costly resource. So for that we need planning and scheduling the OR procedures. So improvement in the OR logistics is essential for cost effectiveness. That is the importance of logistics. That's a beautiful article which came in the Best Practice and Research Clinical Anesthesiology in 2022, which describes several bottlenecks cause delays, backlogging of the patients, increase the cost and impaired medical care. They identified these bottlenecks as related to material, infrastructure related, equipment, patient or communication. The mainly infrastructure related are either due to the design fault or due to the limited capacity. And equipment or material related includes empty stock of the instruments or shortage of our anesthetic drugs. And sometimes maybe miscommunication. Sometimes we need order some investigation and patient has not done the investigation. Maybe staff, adequate staff are not available. Maybe patient related, like the patient not followed your order of NPO. So all these bottlenecks will lead to congestion and delay the optimized patient care or even impair the clinical outcome for the patient. So we have to manage these bottlenecks for the better logistics. So careful coordination and teamwork among surgical specialties, anesthesia, post-op care and other supportive fields are essential. So how we are going to improve this bottleneck? That is the question. Starting from the design itself. if redesigning the OR with separate induction room and early recovery room or an extra workspace for the surgeon in the OR itself, that is shown to improve the logistics and improve the efficiency. That study showed that they have redesigned with extra induction room and workspace and extra space for the surgeon in the OR itself. So that allowed additional patients to be accommodated in the schedule. So parallel works can be allowed by adding the induction room, wake-up room extra. That will reduce the delays. Because you can continue the induction in the separate room when the one surgery is going on in the other OR. And emergence when the patient in the separate room, so that OT can be cleaned and prepared for the next case. So that this will allow the delays. Another comes the equipment. Providing the right equipment at the right time is the key to smooth and secure patient throughput. And the supply chain management must be based on objective inventory system. Always monitor the individual demands of a case and a person, and monitor the stock levels. That will prevent the rush order in the last hour. So sometimes maybe poor decision making and the costly equipment might have secured, and it may not be used. So it might get expired. So decision has to be done depending on the demands and the stock levels monitoring. It is reported that material supply chain delay is the 5th most frequent cause of procedural delay. Sometimes unawareness of the cost among users is also a limitation to the cost-conscious use. So you have to use the supply chain management logistics has to be managed. Another comes the drug supply. Drug shortage is common in globally in all types of countries. And anesthetic drug shortage has got implications because it adversely affects the patient outcome. It will increase the post-operative ICU stay. So it affects the post-operative patient outcome. So drugs and equipments for anesthesia needs to be planned and secured well in advance depending upon what type of case it is. In this orthopedic journal, they have reported that adverse events related to technical equipments and logistics occurred in more than 50% of cases. And they report that these adverse events could have endangered the patient's safety. That is the importance of equipments. Another most important is the communication. That is the need of the hour, how to optimize it. Keeping timely information among all team members is necessary to ensure workflow optimization and to enable the best quality care. And common cause of the delay in the surgical schedule is the surgeon taking too much time or lack of communication. Surgeon must not have communicated with you about the duration of the surgery. So that will cause interruption in the flow of information to the post-operative ward also. And this often leads to interpersonal conflicts that further delays the OR schedule. So whatever the reason for the interpersonal conflict, ultimately it is the person who is, patient who is suffering. So patients' post-operative care need to be considered while scheduling in the case itself. So any major case, whatever the case, the post-operative need should be planned in the while planning the case itself. And sometimes the post-operative ICU may not have adequate bed for the patient who requires ventilation. So that has to be communicated in the planning and scheduling itself. So optimization of OR activity planning is essential to manage the hospital's waiting list. That will improve the cost effectiveness while maintaining the quality of care. So I will spend some more time on the designing of the OR complex. We all know that we anesthesiologists spend most of our time inside the OR. Are you sure? So why not make it a better place so that we can relax safely? Anesthesiologists, by virtue of the knowledge of intricacies of physiology, physics, biomedical aspects and constant proximity to the OR complex, we should be involved from the early stage of planning of the OT complex itself. There are several guidelines from the National Health Mission and NABH for the construction of the OT complex. Salient points only I will discuss. It should be located separate from the general traffic of the hospital, but has access to the accident, emergency, radiology and other lab service. It should have a zone-wise distribution, I will discuss it, and ventilation and temperature control. And of course, there should be a fire extinguisher and emergency exit and provision for future expansion also. That also should be decided in the planning stage itself. The basic principle is there should be 4 zone-wise distribution. That is to avoid crisscross movement of the man and the machine. This is in these 4 zones, the bacteriological count diminishes from outer to the inner zone, whereas the positive pressure decreases from inner to the outer zone. These 4 zones are protected on the outermost, that is the main entrance and the OT reception, trolley area, patient waiting area, all those. And second comes the clean zone, where the pre and post-operative recovery room and the staff changing room, staff room, etc., storage area. Then the innermost is the sterile zone, where is the main OT operation theatre rooms and the sterile equipment storage, autoclave, scrub area, all those in the sterile. That is the most innermost. Then comes the disposal, where is the dirty utility area, pass box, disposal corridor, and the fire exit also. So this zone distribution is essential to avoid crisscross movement. OTs are divided as special OTs and general specialty OTs and general OTs. Specialty OTs require lesser temperature. That is the only difference. The point is multi-use OTs instead of multiple OTs offer advantage of efficient manpower utilization and economical maintenance. Some of the design considerations, there are specifications for the size, doors, etc. Those should be sliding and if possible sensor operated. And walls, floor and ceiling should be non-porous, smooth and seamless without any corners. That is important, because if there is corners, that will be pockets for the microorganism. It should be easily cleanable. This is our new OT complex. And the main doors and corridors should be of adequate width to allow the passage of patient trolley. And the pendant system, there should be 2 ceiling pendants, one for the anesthesia and one surgery. And our pendant system should have 2 oxygen, nitrous, medical air, 2 vacuum and 1 scavenging terminal outlet, at least 4 electrical socket, and should be retractable, and there should be especially shelf for monitor should be there. And the pipe gas in the OT system should be able to cut off from the main supply sometimes if any problem occurs. And the ventilation, the airflow should be directed from the OT towards the main entrance, and there should not be any air exchange between the OTs. And the effective ventilation will reduce the contamination of microorganisms and anesthetic agents and control the temperature and humidity. The laminar flow, it is unidirectional and downstream, and that will minimize the spread of airborne contamination. It should be directed towards it directs from the ceiling array to the exhaust outlet. These are the airflow diffuser from the ceiling, and this laminar flow is direct towards the exhaust. These are the exhaust grills. And there should be minimum total air change of 20, of which at least 4 should be fresh air changes. It should be supplied through the HEPA filters. There are sizes for this. That is called air handling unit. Each OR should have dedicated air handling unit, which should have a filtration efficiency of at least 99% for microns of size 5, and each OT should have a capacity of 5 to 8%. And there should not be any split AC or windows, and because they are recirculating unit and pockets for microorganism growth. And so specification for temperature and humidity, the specialty OT has got a lower temperature of 18 degree and the general OT has a 21 degree, and relative humidity ideally is 55. And there should be a minimum positive pressure in the recommended the OT is 2.5 Pascal, and the difference in the positive pressure should be maintained throughout between the OT and the adjacent areas. And there is the scavenging. There should be either a active or passive, whatever system, it's a must. And this should be planned in the initial designing stages, number and location. Coming to the electrical supply, all electrical equipments need adequate grounding and the power line should be of 220 volts and the suspended ceiling plugs should be of locking type and the load should be calculated on the equipment used. And lighting, depending upon the surgeon, there are also specifications. And communication there should be intercom to connect with the other OTs, central desk and lab service and code signals for emergency. And sterile supply, either direct connection to the central sterilization unit or to the TSSU. And the sterile equipment flow should be optimized to improve the material availability and reducing the cost. And our anesthesia equipments and monitors also needs to be planned. And there are several sub areas like restroom, water supply, data management. This also should be specified. Scrub area. There's a beautiful article in IJ by Hasu sir and Balabhaskar sir. They rightly said that OT complex is the heart of every surgical hospital and patient is the center of the functioning OT complex. And we anesthesiologists with multiple roles should be involved in the planning and designing of the OT complex itself. And another is the teamwork, anesthesia and surgeon teamwork. The teams that work together over time become more efficient. That improves the operating room efficiency and affecting turnover time. So effective operation room teamwork is essential for better patient outcome and comfort. To summarize, logistics should be optimized with a multidisciplinary approach like strategic decision making, tactical planning and operational adjustments. And it has got tremendous effect on economic outflow and patient safety and outcome. And we should take every measures to reduce the bottlenecks to improve the efficiency. Thank you. Thank you for the opportunity also.